So, what's the policy to really face this issue? We like to call it everybody's business, which is the same slogan as the health system strengthening people are using today, those that deal with health system in general. Why? Because we believe, as it has been said by our Director General very clearly, that national programs alone cannot face this epidemic. National programs obviously have the responsibility to strengthen the basics of TB control, which is the top of my bullets there, and also have the responsibility to scaling up proper management of the existing MDR-TB and XDR-TB cases. But when it comes to the other elements of the policy recommendations that we will be discussing during the next few days, then you clearly see that these policy recommendations are not normally in the power of the national programs. They depend on ministers of health, if not above, and they depend on director generals of service, strengthening laboratory capacity, ensuring availability of drugs, and I underline what has been said, fixed dose combination as we have in the Stop TB strategy, their rational use, expanding surveillance, introducing infection control, mobilizing resources, financing, promoting research for the urgency and innovation factors that we have said before. All of these elements really depend on ministers of health, and that's why we want ministers of health here and not a national TB control program only, because the effort has to be necessarily a joint effort. The next one, please. And these are the bottlenecks that largely correspond to what the policy recommendations are. There are bottlenecks at every single level, starting with the major gaps in TB control in the DOT strategy application, which is the factor that produces drug resistance. That's why we like to say, practically turn the tap off first, meaning stop the production of multi-drug resistant TB. The second point is that the care of the existing cases is extremely weak. We heard that less than 5% this year of the MDR-TB cases that we estimate exist worldwide are going to be taken care with a strategy that is compatible with what we recommend. And then we have a series of problems that really, once again, are problems of the health system in general. The health workforce crisis, the inadequacy of laboratories, the quality of anti-TB drugs we will discuss at length that are often poor, especially when it comes to fixed dose combinations for first-line drugs, and let alone, rather, the second-line drug quality. There is no policy of restriction of use of TB drugs that we think, in a situation like that of TB today, actually should be reserved to accredited physicians, those that the government has formed, has trained, and are ready to really use these drugs in a proper way. There is no infection control in the vast majority of countries of the world. There is insufficient research, although innovations are coming, as we heard. And there are major financial gaps that have to be faced. The next slide shows in synthesis the same points I was making. There I'm trying to match on the left the bottlenecks I described, and on top there you have the classical 6 health system pillars that go from service delivery to the health workforce, the information systems, the medical technology, the health financing, and the leadership and governance. And you see that if, for instance, you have to deal with the health workforce crisis, that is an issue in general of the health system strengthening. If you have to restrict the use of anti-TB drugs, it's an issue related to governance and policies. If you have to address infection control, it's the same type of leadership and governance issue as well as medical product issue. So here is a proof that, in fact, if you like, everything that needs to be done to face the epidemic of MDR-TB, in the end, lies in good health systems that are capable of performing these basic items. Now, the next 2 slides deal now with the issue of financing. And this shows the latest estimate of what will be needed between now and 2015 to deal with MDR-TB globally. And we estimate, for instance, that by 2015, we will need something around $4.4 billion a year, of which the vast majority is what endemic countries and their governments have to put to control an XDR-TB. And mind you, this is about 10 times the budget that has been proposed in 2009 and about 61 times what is actually being allocated and spent in real terms in 2009. So we have a real problem there in terms of financing, and we are going to face the financial crisis. The next one shows that, in fact, we are not in good shape. And this is the previous 3 years of the global plan. So you have in blue what the global plan has proposed in terms of yearly expenditure, and in red what has actually become available. And if you take the last year, 2008, you see that that is a fraction. It's about perhaps 20 or so % of what is really needed, what in the budget of the global plan has been proposed. To tell you once again that there is a major funding gap that has to be filled. And this requires the political commitment we were discussing, and it requires the help of the international institutions that are providing financing. Because if financing goes down, then progress will be obviously slowed down. And mind you that almost entirely the budget that is available in real terms today comes from 2 countries that are the Russian Federation and South Africa. So to come towards the conclusion, what are the aims of this conference? The first one is to strengthen political commitment. We have said it in different ways, but we need the full engagement of the high level of the ministries to face this epidemic, especially for the emerging economies that are perhaps going to be less affected than others in the era of financial crisis, certainly some of them. And second is to use catalytically this political event to really define the plans that countries need to be put in place to go back home, and then study how they're going to face the bottlenecks that I have described. What are the expected outcomes? Clearly, a significantly increased commitment and more awareness at the highest level that here we are dealing with a potentially explosive, in fact, with an explosive situation that has already exploded in parts of the world. And secondly, ministers that go home with the understanding that comprehensive plans are necessary, and not necessary tomorrow, but necessary today. Second, for the donors to be sensitized about the needs that are there for external resources to complement what domestic resources should be. Then we want a call for action, a document that your delegations have seen in previous gathering, like the one we convened in Geneva in early February and via email. A call for action that underlines all the points that I've made up to now. And finally, we will use this call for action, or rather the Chinese government may use this call for action for the resolution that has been proposed by the Chinese government for the World Health Assembly in May. So that what you come up with and the consensus that is built will be also used to expand it to all the member states. The next one is essentially what is going to happen afterward, because nothing is ending here. In fact, as we were saying yesterday, even jokingly, this is not the end of the war, it's not even the beginning of the end, it's just perhaps the end of the beginning. So here we have a bunch of other events and important action that are necessary. First of all, that in countries. We need resource mobilization, we need clear plans, we need mobilization of the community involved, and I'm very happy to see here community representatives that will speak to us. Then we have the World Health Assembly in May 2009, where there will be a resolution, once again proposed by the government of China, on the MDR and XDR-TB solutions. And finally, we have also another big event before the middle of this year, which is the Pacific Health Summit in 2009, June, that will be devoted specifically to multi-drug-resistant TB. So it's a unique opportunity in the next 3 or 4 months to maintain the momentum and really take action. And I'd like to end with a quote from President Sampaio's recent publication on tuberculosis. He says, "To end this scourge is a mere question of civilization." Many thanks to all.